Mariko Hiyama, welcome to Ayurvedic Healing and Beyond podcast.
Thank you, Dr. Vignesh, for having me here today.
So, Mariko, I've been following your work and you've been visiting Sitaram quite a lot of times. And also, I know the more and more I come to know about your work about face reflexology. And I see that a lot of people have this issue of tightness of the jaws. And whenever I see people are having pain in the neck or neck pain, shoulder pain, or sometimes I even hear when couples come together as for consultations, the wife might say, "Oh, my partner, he keeps grinding the jaw at night." And we have multiple approaches to deal with this. But from your point of view, I mean, let's just jump deep into that because this is one of the most common issues that I find it. If we can help people reverse their jaw tension, I think a lot of stress, a lot of pain, a lot of emotions, this can be reversed, I guess. I mean, the bad parts of that can be reversed.
I totally agree with you. So jaw tensions, jaw grinding, I often have the people come with that problems or challenges in their daily life. And in that sense, I always start with the emotional part.
So you mean to say that people who are having tightness of jaws have a lot of emotional problems, or what exactly are the emotions that are contributing to this?
Normally, what I find is the stress related from the work, for example, financial situations, and also in the daily life, there is something like accumulated day by day. And that something is not resolved, or they have not realized that these elements were the causes of the tensions in the jaw. But actually, often, what I find is that those people who have jaw tensions also have neck shoulder tensions.
Yes.
They're all correlated. And then also comes down to lower back because our shoulders and lower back are diagonally connected. So often these three parts are connected. So I need to work on releasing tensions from each part, not only jaw, but also different part of the body.
I see. That's quite interesting how just one tightness of the jaws can go down to your low back pain as well.
Yes. Very often people come, okay, I have lower back pain issues. What do I do? And it's good that they come to me for face reflexology because all the emotions and thoughts are coming from here. So if I can tap into that part with the face reflexology, then how we can resolve it's much easier and then smoother.
And I've read about the fact that how strong the jaws are, and you have the power to chew it really hard, but I don't know the real numbers, but they say that it can be really powerful like a machine cutter. That's how powerful the jaws are. And even if I have emotional issues, how do I become conscious and reverse this condition?
That's a very good question. I think that would come down to the emotional intelligence, like how we recognize like what we are feeling within our body and mind, and finding the causes. Why are we feeling angry? Why are we feeling frustrated, irritated? And I think it's always important to come down to the causes. Through face reflexology, what I do is that by touching people's face, I will analyze which part is actually most affected. And based on the analysis, we look into the mapping systems, which is going back to traditional Eastern medicine systems, the organ systems, emotions, and each part of the body, how they are correlated. And then we can actually tap into the actual causes. It could be sadness. It could be another unresolved issues within their life.
I see. So if I am able to deal with my emotions better, there could be a potential reduction in my jaw tension. That's what you're
I
saying.
would say so. Yes, that's how I believe.
And knowing what you do with the face reflexology, I mean, I understand how important face is for anyone. When I see a patient, when they come with one small acne, they come with so much of anxiety and they feel like the world is coming to an end. So that's the importance that we give for the face. And if you look at the beauty industry and face, you judge people with their face, even though we say don't judge the book by its cover, but a lot goes in the face. Sometimes, the lines on your forehead tells a lot about your struggles or your wisdom or things like that. Some people do face reading and judge people according to that. Now, knowing what you do, tell us more about your experience with face and what you do with face reflexology.
Thank you for asking the question. Face reflexology, actually in our school system, we call facial reflex therapy or face reflex therapy. This is actually created based upon traditional medicine systems such as Tibetan traditional medicine, Chinese traditional medicine, and also Japanese acupuncture systems, Vietnamese, and also some of the very unique technique coming from South America. And this technique is actually created by my teacher, whose name is Lone Sorensen. She combined the ancient wisdom technique with the approach of modern neurobrain anatomy. So by combining them, we can actually tap into very deep layer of our body, mind conditions. So for example, you mentioned that nowadays, like beauty industries, it's booming and so many people want to do Botox fillers and these external approach to look them younger. However, what we believe is that how we look is completely the internal expression showing outside. So if we accumulate sadness too long, certain area of the face will show the reflection. Can be shown as wrinkles, can be shown pigmentation, can be shown as muscle changes on the face. So by knowing such background, by touching our client's face, we can release such stagnated emotions or conditions and then slowly change their face into better version of themselves.
Could you give some examples?
So many examples.
Like what happens in a session? What do you expect in a session? So you feel, how do you feel the stagnation? Do you feel it through an energetic way, or you feel it like there are some points where you feel some bulge or some retention or stiffness? How do you describe that stagnation?
Thank you. That's a very good question. So we in a school, in the Sorensen System School, we teach people how to use our fingers and then how to identify stagnation underneath of the skin. So normally we identify from the 5 different steps. First step it's just a little bit of stiffness. But then this stiffness, they can go harder and also wider range in the face. So by touching that, we can identify different stages of the person's internal condition. Then based on the identification, we can make different treatment program on the spot. For example, would you like to try?
Yes, I would love to.
So many times it's very hidden, but underneath of the cheekbone, this area.
You mean this part?
Yes. And I normally go very deep with my finger to touch my client's face. And differently, I can feel sort of like rock, small sounds moving. And also most of the time, my clients, they feel some, not the pain, but uncomfort. So they normally tell me that, I feel something there. Or maybe if they are sleeping during the session, they will normally tell me after the treatment that I felt something when you're touching here and there. So this way, we can identify what is happening.
Actually, if you look at emojis, it's a way to describe your emotions in a symbolic manner.
Yes.
And I think people can understand what emotion a person is going through just by looking at the face. I mean, you don't need to be a Harvard-trained psychologist. Just by looking at the face, if the person is happy, sad, angry, to a great extent. Some people are good at keeping a poker face, but I think a lot can...
Sense.
So the point that you're saying is our dominant emotional display through our face will start creating a patterns in our face. And if it is something good, it's okay. But if it is something not so pleasant, this can start creating energy blocks.
That's
Did
absolutely,
I understand that right?
Yes. So if you're familiar with the meridian system, which is energy path systems in our body, that actually run also in our face. So by using that meridian theory, we can identify what's happening.
I see.
And also once the blockage becomes so strong, then we can differently feel it when we touch people's face underneath of the skin. And you mentioned about reading the people's face. Even babies, they can sense adults, the parents' face, and they can sense what's happening in their family, in the house. There is a very interesting story that one of my clients told me. That my client's friends apparently had a Botox treatment. And this person has 2 children. After this person finished the Botox, went back home. And of course, when you have a small children at home, teenager or even smaller one, some conflicts might happen in the house. And once, apparently, they had a little fight with the children and the mother. And what happened was, the children said, "Mommy, I'm very happy that you did the Botox because I don't know if you're angry or not."
Oh my God.
Can you believe this?
So it's like it masks your feelings and emotions because you're not responsive to that.
Yes. So that story I was told by one of my clients. And I felt like...
So it's true that when people do Botox, they are not able to express their emotions through their face. I've only heard it and I've only seen it, but it's quite...
I can only say by seeing because I never done external procedure. So I don't know how exactly, I would feel. But by watching, observing people, and also the clients who have done it in the past, differently I can see, I can feel. And also themselves can feel the difference. Like I normally don't do any treatments if they do Botox filler like 2-3 weeks before visiting me. But some clients, they had probably a couple months ago, even a few years ago. And after the treatment with me, they differently feel the difference in their face muscles, the way how they feel, completely different.
What would you recommend to take care of our face muscles and the face skin?
Yeah. That's I think there are so many ways to do, but
for a common man, with our basic resources that we could have, what would you recommend?
I have a very good solution. So I'm a believer in the natural care. So I only use oils to do my own face. And what I do is just I wash face after shower. And then apply 2 drops of oil, natural oil.
Any particular oil that you use? Coconut oil, sesame oil, or even Ayurvedic oils?
Yes, absolutely. Ayurvedic oil. Nowadays, Kumukumari oil is getting a lot of attentions. And I personally love eladi oil.
Okay.
Eladi oil has a very sweet for me. And also the base, especially in Sitaram, they use coconut oil as a base. And then that gives me a sort of a nice relaxation. So I personally like eladi oil. And also when I'm traveling, if I have limited options, I just use whatever the oil that I carry for my client's treatment, I mix for myself and I use.
I see.
My favorite is apricot seed oil and sesame seed oil.
Just fresh sesame oil or these oils?
Just the sesame oil. People ask me, like, can I use from the kitchen? The kitchen sesame oil is actually different from what we use for treatment. So if any people wants to use sesame oil, I would suggest to use modified for treatment.
Like for skin application, fit for skin application.
Yes, that's correct. Yes. Yeah.
And anything else with... the people are so concerned about anti-aging and facelifting and all of this. What are the natural methods that can be done so that we look young? And this is every person's need.
Yes. So I provide self-facelifting program, like using your own hand, how to massage your own face muscles. It's not about the skin. It has to go deeper to stimulate the circulation and also muscle tonings. And there is a very simple technique that they can do every day. So that's one thing I teach. Also, smiling. Some people are afraid of, if I smile, there would be some wrinkles around the eyes. But that's another beauty. So smile a lot. That's another way of doing anti-aging.
But is it true if you
smiling.
smile a lot, you have wrinkles? Or is it just a myth?
Some extent it's true because we are using extensively face muscles. And then the skin also, around that. It's moving in the same way. And the way how we smile, we have patterns. We have habits how we smile. So of course, if we do the same smiling every day, there might be some extra lines. However, in my personal opinion, such smile wrinkles is very cute and attractive.
So you shouldn't be afraid of that. That's
I would say so, yes. Why would you hide such a symbol that you've been smiling and being happy?
I think people feel they'll be judged that they're getting old or they're not at their vital best. So how do we change that perspective?
That is the ongoing
Process.
process, yes. So I often open workshop and also one-to-one sessions. I would sit with my clients and sort of have a conversation to open up different point of view, how actually aging is beautiful. We should not be afraid of aging. If we maintain good sleep, good food, diet, exercise, and being kind to other people, and then do minimum self-cares, I think that would make already a big difference.
Anything like a small demo that you can show us? So
Yes, of
what are the
course.
basics that we need to take care of the face? All we know is use face wash, and for men, face wash and maybe some cream, and that's it. For women, maybe there is a little more.
Indeed.
But what would you recommend, like to take care of the face health?
Yeah, if you could give me some examples, like where you like to focus, or if any family members or staff and guests, they come with that probably common
Maybe
questions.
how to keep your facial skin young and healthy.
Okay, so differently when you do treatment, you need to use natural oil, and one good idea is to do lymphatic drainage system.
How do you do that?
So
You can
it's
use it with your
very-
own hands.
Yes, own hand, and it has to be very gentle.
So you need to use what, your pulp of the fingertips? Okay.
This fingertip, tip. And then it has to be very gentle, along with the hairline, the side of the face, and the side of the neck, and you come to sternum, and then slowly open to the side. And if we can do this at least a few times in the morning and before you go to sleep, that should help to regenerate the skin system faster. And also you can do on the cheek, from the cheek
You
side
mean
to ear.
above the cheekbones?
Yes, on the cheekbones. You can use 3-4 fingers, so you can go the wide range on the face, and then move down to neck. So this is one technique that I could think of.
Yeah, sometimes people complain about my face looks puffy, especially if they have more sugar-rich or fat sugar-rich, or maybe sometimes even when they consume certain beverages, it can lead to that problem. Anything that you recommend for that?
So in that sense, we would go dynamic movement. So face reflexology, I do actually 3 pillars in a treatment: face reflexology, face reflextherapy, and Japanese facelifting, and trauma releasing. So normally, if people complain with puffy face, I would start with the face reflexology and finding why that's happening. That's very important. Of course, diet can be one thing. Sleep, lacking of sleep can be the cause. And it could be also from another internal organ systems, might not be circulating enough. So by using face reflex therapy, identify what's happening and see if we can balance the system and see if we can reduce the puffiness. And continuing that, that's one thing. After that, we can move to different programs.
Now, when you say trauma release, and in the beginning we started with the topic of jaw stiffness, jaw grinding. And do you see a connection between these two?
Yes.
And can you describe more about trauma release and the jaw stiffness? Because in my practice, I see a lot of patients with stiffness of jaw, like with migraine, with high blood pressure, with neck pain. They'll have this sensitivity or trigger points in different parts. And I see that jaw grinding or jaw stiffness is a common problem.
Indeed.
Now, again, coming back to when you say trauma release, can you describe more why this is happening and what you do and what can people do to if they know that this is happening with them?
So the trauma releasing, what we do through our Sorensen system is that we will see how these memories, the physical body received, how emotions are correlated. And by touching the face, we can identify emotions and also which part of the body is storing the experiences. So by touching the face, not only the face actually, we also touch our feet. We try to open the energy path which might be blocked by the particular experiences. And by doing this, our body can slowly let go of the negative emotions, the memories stored in our body and mind. And this way we can experience very smooth, calm way of trauma releasing. This is how we approach. So from the face, the almost North Pole on the earth, and feet is the South Pole. So we need to balance the energy from the north and the south, yin and yang. And this way we can help releasing people's trauma.
And would you say something about the sleeping posture or with the neck pain? Any relations that you see?
Yes, always it comes back to emotions. If we are holding certain emotions, our posture would change. For example, like if we go through sort of depressive time, our posture tend to be hunching forward. And our body sort of memorize this posture as normal. So even when you go to sleep, you're holding the body in hunching. So that would make our breathing process is shallower. And if our body cannot absorb enough oxygen during the resting time, what would happen to our brain? What would happen to the rest of the body? So there is definitely a huge connection between that.
So you would always recommend to correct the posture and...
So correcting posture from the face reflexology and also foot reflexology, we can do that. So there are particular mapping systems on the face. For example, the center line on the top of the nose from the forehead, it's a spine. So stimulating this part gently can send a signal to our spinal system to open up.
I understand.
In the same way on the feet, there is a particular line on the feet, very powerful, very effective line to activate spinal system.
Could we do a short demo?
Yes, of course.
On what can be done for our face?
Yes.
I mean, once you said about the lymphatic drainage that you said, if I have to do something on a regular basis, all we know is just use face wash. But little more than that, what should I do to take care of my facial muscles?
So one question to ask ourselves is that what do we want to improve? For instance, like quite many people come to me that my eyes are getting bad, cannot see well, or the eyes are puffy, dull. So in that case, we need to increase the circulation around the eyes and also train our muscles around the eyes. So I'm using normally fingers or 2 fingers, then circle around.
It should be very gentle. It's very important that we do it in a very gentle way.
I actually do with a little pressure.
Okay.
Because...
But that is when you do it, but if you do it on self...
You can actually control.
Okay.
If you feel uncomfortable, you can reduce the pressure. But if you feel good, then you can go a little bit deeper.
Okay.
It's always the moderation.
But it should not hurt you.
Differently.
Okay.
Differently, yes. So it's always keep moderation and start with a gentle touch. And then slowly you can increase the pressure. And if you feel something is too much, then reduce.
Okay. So now let's continue. Sorry.
Yes. So that's the eye area. And some people come with this line. But I actually found out that this line is somehow connected to this line on the face, on the forehead. So I would also massage the forehead intensively in order to reduce the line around
I see.
the cheek.
So it's good to self-massage your forehead.
Absolutely, yes. And also it helps to calm down your mind because the frontal lobe, forehead.
Sometimes when we get headache, we do a self-massage.
Yes, exactly. So lots of parts are deeply related to our brain cortex. So when I talk to people, okay, on the front part, we have a busy monkey. In order to calm down the busy monkey, you can use your fingers or hand to just massage forehead, center part, and also back of the head, both sides, placing hands, and your monkey mind will calm down.
So if we have to take summarize the key takeaways, one is your face is a very valid extension of your dominant emotions. So it's very important we take care of our emotions. That's the best therapy for your face.
Yes.
That's one thing that I understand. And if we notice people having a strong jaw tension or a jaw grinding, they have to work a lot on their emotions and their postures. And also, in our practice, in Ayurvedic practice, when we improve the gut health also, certain people's jaw tension reduce.
Yes.
But apart from that, when people are going through some burnout or anxious tendencies for a long period of time, they tend to bite their jaws. And I think if you notice people are doing that, do everything in your capacity with the right resources, right therapist to reduce that. Otherwise, your spine health, your shoulder health, your back pain, this could be one of the complications because of that.
Yes. Yeah.
And then another thing is we all need to use natural oils. Did I get that right?
Yes. It's very important.
So your recommendation is apricot oil or sesame oil that is modified for, that is fit for use for the skin.
Treatment, yes. And also, jojoba oil is also very widely available. So jojoba, or some people say jojoba, that's also
Jojoba oil,
yes,
yes, I've
it's
heard
very
of.
light version, so it's easy to use.
And I think the end point is taking care of your face is a very powerful shortcut to taking care of yourself.
Absolutely,
we could also look at it that way.
Absolutely, yes, yeah. How we look, how we feel.
Anything more you want to add, Mariko-san?
If demonstration helps, I can go through at least the points.
Yes,
the
it will be
entire
lovely,
point.
yes.
Yeah, okay. So using your two fingers, starting from the lower part of the face, and with a firm pressure, circle 6 to 8 times, and slide along with the bone on the face, and you will feel a dent when you slide your fingers, and then rotate, circle, and move up underneath of your ears, and then come to the midpoint of the ear. A little bit of higher, connecting point of the ear and face line and temple. And move up to forehead. This is the highest part on the forehead. And then come down onto your eyebrow. Move down underneath of your lower eyelid. Go down, and there is a cheekbone, and go a little bit deep in. And next to the nose. And the side of the lips. Okay, so this is one step I could recommend.
Thank you, Mariko-san. How can people reach out to you and connect with you?
Yes, so I use Instagram as my business card.
Mhm.
So if you have an Instagram account, you can find me under maitori_mariko.
Mhm.
And also WhatsApp, emails. These are also another way to reach out for me.
Okay. Thank you, Mariko-san.
Thank you very much.